Hi Aiden, hi Harper. Since you both are already familiar with type 1 diabetes, I'd like to walk through what we as medical staff look for before making a diagnosis. Aiden, since you've experienced this firsthand, could you share some of the early symptoms you noticed before being diagnosed?
Sure. For me, the biggest thing was that I was always thirsty. I drink water all the time, but it never felt like enough. And I was running to the bathroom constantly.
I remember you telling me about that. Didn't you also lose weight even though you were eating more?
Yeah, exactly. I was eating a ton, more than usual, but I still kept losing weight. And I was super tired, like I couldn't keep my eyes open at school.
Those are very characteristic symptoms of type 1 diabetes. In the medical setting, we frequently see excessive thirst, frequent urination, unexplained weight loss, and fatigue. Other warning signs may include blurred vision, nausea, abdominal pain, and in some cases, fruity smelling breath. These symptoms are the body's way of signaling that blood glucose is rising to unsafe levels because the pancreas is no longer producing insulin.
So when Aiden went to the doctor, how did they figure out it was type 1 diabetes and not something else?
That's an important question. Diagnosis involves both listening carefully to the patient's symptoms and confirming them with laboratory testing. The first test we typically perform is a blood glucose measurement. If the level is significantly elevated, usually above 200 milligrams per deciliter in someone with symptoms, that strongly suggests diabetes. We also often run a hemoglobin A1C test, which gives us an average of blood sugar control over the past 2 to 3 months. Elevated A1C values support the diagnosis.
I remember they also checked for ketones. Mine were really high at the time.
That's correct. When the body is unable to use glucose for energy, it begins breaking down fat instead, which produces ketones. High levels of ketones can be dangerous and may lead to diabetic ketoacidosis, a serious medical emergency. To confirm type 1 diabetes specifically, we can also test for autoantibodies in the blood. The presence of these antibodies tells us that the immune system is attacking the pancreas, which is the root cause of type 1 diabetes.
So it's not just one test, it's a combination of symptoms and lab results.
Exactly. We take a comprehensive approach. Clinical symptoms, blood glucose levels, ketone testing, A1C results, and antibody testing all work together to confirm the diagnosis. Once it's clear, treatment begins immediately with insulin therapy, along with education and support for the individual and their family.
Yeah, I remember once I started on insulin, I had so much more energy and felt like myself again.
That's really good to know. I guess recognizing the signs early makes a big difference.
It does. Early recognition and prompt treatment are critical to preventing serious complications. That's why increasing awareness of these symptoms, especially among families, schools, and healthcare providers, is so important. At SDRI, we are committed to advancing research, improving care, and making sure more people recognize these early warning signs of type 1 diabetes.